Now, there is such a thing as getting too much sun. That can lead to skin cancer. Melanoma is the #1 killer of young women. The median age for melanoma skin cancer is just 28 years old. I know it's shocking. With something so deadly, you want to get the very best treatment. And to do that, you need to know exactly what you're dealing with. Well, that's where this new technology comes in. Dr. Robert Bard, a dermatologist on Manhattan's East Side, has made his life's work to be on the cutting edge of finding tumors quickly and accurately.
There were really two kinds of cancers, cancers that kill and cancers that don't kill.
He's a pioneer in the use of this state-of-the-art technology that can tell the difference. You're looking at a melanoma just poking a bit above the surface of the skin. Standard practice is to shave a little bit off the top and do a biopsy. But that little top turns out to be just the tip of the iceberg. Dr. Bard's use of a 3D ultrasound on the melanoma shows us how.
So the white line is where the shave biopsy would be on this malignant melanoma. What's important is if you would actually have done the ultrasound scan below, you would see that the tumor has already spread below to the subcutaneous tissue before you do the biopsy. This is currently what we're doing now with breast cancer and prostate cancer. You look very advanced disease, which the doctor can't feel because the spread, the metastasis, is below what he feels with his finger or what he can see with his eyes. This is an example of why it's better to look at the skin and under the skin with either the MRI or the ultrasound before you do the biopsy.
The 3D imaging allows you to see the skin and the subcutaneous tissues in 3 dimensions.
While something may look obvious in one plane that you're looking at, it may be even more apparent to see the depth of it or the configuration of it in the second or third plane that are simultaneously visualized.
This 3D is a much higher resolution machine than most ultrasounds. Dr. Bard is able to show a surgeon exactly where to cut, how wide, and how deep.
If there is a tumor that's growing under the skin, using robotic technologies, computers and MRI or ultrasound, we actually fuse them together. We put the laser fiber into the area that's abnormal, and you heat it using the laser. You can also control the spread of the heat or the laser fiber's energy so you don't damage other tissues. It's image guided.
This patient had a routine biopsy done which showed a precancerous condition. But before her doctor did any freezing or cutting, he sent her to Dr. Bard to find out what was going on under the skin.
I'm not facing surgery. I mean, I'm so relieved. Nobody wants surgery, especially on the face.
Now here's a man who had surgery on a tumor. It grew back.
That's the tumor. And this is the depth below, and this is the actual bone of the skull. So it's a tumor that's burying itself. They got some of it, it grew back.
Dr. Bard brought this technology over from Europe, where they've been using it for 15 years, and he practices what he preaches.
I've got a dark spot on my hand that's irregular, and anybody would think it's something that should be biopsied, except I did my own scan, and I found that it's less than 1 millimeter deep. It's also been there for 30 years and hasn't changed, so there's no reason to do it. I feel confident, having a 99% safety level, that it's worth leaving alone and following.
Dr. Bard teaches other dermatologists how to use this technology. He hopes it will become standard practice.